Hello. All right. Good afternoon. Welcome and thank you for joining us for today's event, The State of Obesity, Creating Pathways to a Healthier America. My name is Stacy Molander, and I serve as Chief Operating Officer for Trust for America's Health, or TFAH as we're commonly known. I am honored to serve as today's MC for the event and to welcome all of you both in person and online. Thank you for joining us. TFAH is a nonprofit, nonpartisan public health policy, research, and advocacy organization that promotes optimal health for every person and community and makes the prevention of illness and injury a national priority. Today's event is a historic one for TFAH. It marks the release of our 20th edition of our annual report, examining our nation's obesity epidemic, its root causes, and policy solutions. We have an amazing agenda for the next 2 hours of distinguished speakers from the White House, federal agencies, public health, community, medical experts, and even an Olympian. But before we turn to our first panel, some logistics. For our participants joining the live stream, you can submit questions by clicking on the Q&A button at the bottom of your screen, and we'll try to respond to as many questions as possible. For our guests in the room, at the end of each panel session, we will have staff circulating with microphones to facilitate questions. Now it is my honor to introduce my colleague, Dr. Nadine Gracia, who will be facilitating the fireside chat in our first panel session. Dr. Gracia is the president and CEO of TFAH, where she leads our work to advance sound public health policy, health equity, and address social determinants of health. Dr. Gracia previously served in the Obama administration as Deputy Assistant Secretary for Minority Health and Director of the Office of Minority Health at the U.S. Department of Health and Human Services. She also served as the Chief Medical Officer in the HHS Office of the Assistant Secretary for Health. And relevant to today's discussion, Dr. Gracia was recently appointed by President Biden to a 2-year term as a member of the President's Council on Sports, Fitness, and Nutrition, and is also a member of the National Academies of Science, Engineering, and Medicine Roundtable on Obesity Solutions. Please join me in welcoming Nadine to the stage.
Thank you, Stacy. Greetings, everyone. It is such a pleasure to see all of you, and wonderful, wonderful to know that there are so many that are joining us via the live stream. We are truly honored to gather today to commemorate the 20th edition of one of Trust for America's Health's landmark reports, the State of Obesity Report. We're going to be reflecting on key milestones of progress over the past 2 decades, and most importantly, we're going to discuss some of the transformative and innovative opportunities for us to collectively create pathways to a healthier America. Now, when discussing the current state of obesity in the United States, it is certainly important to put this public health issue into context with regards to the overall health of the nation. Even before COVID-19, we were facing significant health challenges as a nation. Starting in 2015, the U.S. was seeing a troubling decline in life expectancy. Alongside this, there were persistent health disparities that existed, and in some cases, they were growing more pronounced. And healthcare costs were on an upward trajectory, with chronic diseases, such as obesity, helping to drive this increase. Now, let me in particular note that we are addressing obesity because it is a common yet complex chronic disease, both among adults and children, that is impacted by many factors that are beyond personal choice. Obesity is putting a strain on individuals and families, affects overall health, contributes to rising healthcare costs, and even impacts military readiness. But the focus is not on body size, but rather how to assure the conditions that promote healthy weight and equitable access to healthy nutrition and physical activity to ensure that they are present for every person and community. Now, in order to begin to reverse these trends, we must look at the root causes of chronic diseases like obesity and understand that drivers of poor health are more expansive than what solely happens in a doctor's office. And we're going to dive into these issues and discuss many of these factors with our incredible group of speakers here today. To gain a deeper understanding of these issues, TFAH analyzes the obesity and overweight data that are collected by the Centers for Disease Control and Prevention and studies the underlying structural factors and inequities that contribute to poor health outcomes. In addition, TFAH prioritizes equity and recommends evidence-based policies to prevent obesity and to increase equitable access to healthy nutrition and opportunities to be physically active. So what have we seen over these past 2 decades? We've seen policy accomplishments that have made important strides toward the goal of ending disparities and reducing the prevalence of diet-related diseases, including obesity. Policies such as expanding nutrition support programs, revising the WIC food packages and increasing WIC benefits, implementing complete streets, strengthening the nutrition standards of school meals, and implementing taxes on sugar-sweetened beverages and utilizing the revenue to support public health initiatives that address health disparities, nutrition security, and obesity prevention. These have all been important steps forward. Yet despite these important milestones, as you're going to see on the slide that'll be coming up shortly, over the past 2 decades, the national rate of obesity among adults has increased by 37%. And the national rate of obesity among youth increased by 42%. And we don't have the image yet on the slide, but those of you that are in the room have hopefully a hard copy of the report. All of these graphs and images are certainly available in our report. In our 2023 report, which we released last month, we also show that 22 states now have adult obesity rates at or above 35%. And to put that into context, no state in 2012 had an adult obesity rate at or above 35%. The rising rates of obesity are occurring across all population groups. And yes, with persistent disparities among people with lower incomes, certain populations of color, and people who live in rural areas who are more likely to live with obesity. But what all of these trends are underscoring is how obesity is a societal public health issue. But we are now in a pivotal moment to leverage new momentum that's been created by the historic White House Conference on Hunger, Nutrition, and Health that was held 1 year ago with a vision to reduce diet-related diseases and close disparities by 2030. TFAH's 2022 State of Obesity Report was cited in the National Strategy on Hunger, Nutrition, and Health and helped to inform some of the strategy's goals. So with that background, our program for today is going to feature a fireside chat with a representative of the White House to reflect on the 1-year anniversary of the National Strategy on Hunger, Nutrition, and Health and the opportunities moving forward. We'll then have 2 panels. The first panel is comprised of senior federal government officials from across sectors discussing their agency's actions on this important public health issue. The second panel is comprised of leaders from the community who will highlight the incredible efforts happening in communities and the work that remains. And then we'll close out with a motivational message from an Olympian who is a member of the President's Council on Sports, Fitness, and Nutrition. Now, during the panels, we will have time for questions from the audience, as well as opportunities to share ideas and solutions. So let's begin. Please join me in welcoming Will McEntee, a senior advisor in the Office of Public Engagement at the White House, who is here to discuss the administration's commitments and historic actions to reduce diet-related diseases. Will, I'd like to invite you to the stage. Let me just do a mic check. Is everyone able to hear me okay?
Test, test.
Perfect.
All right.
Excellent. Well, thank you so much for being with us today, for joining us for the work that you're doing at the White House, which is so critically important. It's been a year, 1 year, an impressive year, since the second ever White House Conference on Hunger, Nutrition, and Health and the release of the National Strategy. Can you share with us some highlights? What is the progress that you've been seeing in this first year? What are some of the accomplishments that the White House is noting to really advance the goals of the strategy?
Absolutely. Well, first of all, thank you, Dr. Gracia, for hosting this event, and to the Trust for America's Health for all the work they do to highlight especially issues related to diet-related disease through the State of Obesity report. And also, as you just highlighted in your brief presentation, the disparities that exist amongst communities as well, which is really a part of the President's goal and vision here. As you mentioned, we are just over the 1-year mark of since the White House Conference on Hunger, Nutrition, and Health. My wife and I joke that we'll never forget the date of the White House Conference on Hunger, Nutrition, and Health because we got married 3 weeks prior to the conference.
I did not know that.
So the anniversaries match up and will for the rest of our lives. So very busy time in our lives, but excited to see the progress that has been made since that date, both from the agencies. I know you'll hear from leaders from USDA, FDA, and CDC here after this conversation. But also throughout civil society. So at the conference that the President hosted, we both released the National Strategy on Hunger, Nutrition, and Health, really taking a whole of government approach to addressing the issues of hunger and diet-related disease, including obesity. But we also announced over $8 billion worth of external commitments from the private sector, state and local governments, academia, nonprofits, foundations, philanthropies, all sectors of civil society to help meet the President's goal of ending hunger and reducing diet-related disease while solving for disparities that exist in different communities by the year 2030. And just to highlight some of the progress that the Biden-Harris administration has made on the national strategy, I'll just tick off a few of the updates from year one. The administration has worked with Congress to enact a bipartisan permanent nationwide summer EBT for children program, as well as serving non-congregate meal options for children in rural areas. You just addressed some of the disparities in rural communities. We approved groundbreaking Medicaid Section 1115 demonstration initiatives in Massachusetts, Oregon, Arizona, and Arkansas that seek to address unmet social needs by testing coverage of services such as evidence-based nutritional assistance and medically tailored meals. We also opened a request for information on food as medicine research opportunities through the NIH. We also issued proposed rules to make school meals even healthier and expand access to free meals to more students, as well as to remove barriers to use WIC online and to update nutrition standards for the WIC food package, and to update when a food package can make the claim that it is healthy. We also have issued proposed rules that would reduce sodium in the food supply, as well as update the criteria for when food and beverages can use the claim healthy on their packaging. And we've taken steps to inform the development of a potential front of package label for foods and beverages. And finally, we've expanded food as medicine programs at VA healthcare facilities and launched the produce prescription pilot program in the Indian Health Service. So just in that update alone, you're seeing updates from several agencies, throughout the administration, throughout the federal government, who have made tremendous progress just in this first year. And we're really excited to see what progress the next year will bring.
Yeah, that's terrific and really great progress that's been made, Will, and you've set up really the federal panel discussion very well, because I know many of our panelists are going to dive more deeply into those areas of actions that their agencies have been taking. And it's so important to have the whole of government approach. The strategy also calls for a whole of society approach. Can you talk to us about the commitments specifically from the private sector? There were commitments that were made that certainly were important with regards to increasing healthy eating and access to physical activity. And what do you still see as remaining? What do you still need from the private sector with regards to stepping up to taking actions to help support the goals of this national strategy?
Yeah, absolutely. Well, I guess I'll start by saying that really the purpose of us seeking these external commitments has always been that just the general understanding that the federal government cannot end hunger and reduce diet-related disease alone. This is going to take the work and effort and sacrifice of everyone in this room, everyone watching online, everyone across the country who can really play their part. And so again, in that first round of commitments, we saw several commitments from private sector entities, from state and local governments, from academia and universities, from philanthropies, nonprofits. And it's been incredible to track the progress in year one. So the CDC Foundation has been our partner in both securing and tracking these commitments. And so we continue to keep in touch with those commitment makers to mark their progress, how quickly how are they moving towards meeting their goals? If they're in some cases where they are, meeting their goals maybe a little faster than they thought they might, could they kind of take that next step and make a new commitment? We also, because we had such a short runway to plan the White House conference and to call for those commitments, we did launch a second call for commitments, which we've called the White House Challenge to End Hunger and Build Healthy Communities, which we launched in April. We are kind of nearing the end of that challenge, but we're really excited both about, again, all of the sectors of civil society who have stepped up, who are drafting and making commitments and finalizing those commitments. And we're looking forward to announcing those new commitments at an event later this fall, as well as having the opportunity to mark progress that has been made on the first round of commitments and the progress that the administration has made in implementing the National Strategy on Hunger, Nutrition, and Health thus far. We have, in this round, we've called both for commitments that result in systemic long-term change, but as well as opportunities to fill the gaps where the federal government may not be able to, and also that really play well within the actions that the administration is taking to implement the national strategy. And we've called on state and local governments who have a role to play in making local policy decisions that allow for better access to nutritious foods. We've called on the private sector who plays a big role, both through the food industry in offering nutritious options, the healthcare industry, and providing coverage for food as medicine or produce prescription interventions. We're excited about the opportunity to lift up the new commitments that are being made and finalized now. But of course, look forward to connecting with additional partners that are excited about joining this work with us.
Thank you for that, Will, and I'm sure this audience and those watching online are anxious to hear about the fall event and to learn more about the progress in that space. That's really exciting to hear. You've started to allude to it with regards to looking forward. The opportunities that may still be on the horizon. The strategy has set forward specific goals. Are there things that you and your colleagues at the White House are seeing as opportunities that are really on the horizon that we can continue to accelerate even the progress with regards to these goals?
Yeah, so I guess first of all, just another thought to add on to the White House Challenge to End Hunger and Build Healthy Communities. So, we really identified in this challenge, we were a little, during the first round of commitments, we provided some guidelines for the types of commitments we were looking for. But this, second round was really, around kind of highlighting the gaps that we saw both in the first round of commitments, but also really, kind of highlighting again, areas that we're, looking to implement, through the national strategy and commitments that would complement some of those areas from the national strategy. And so, for the private sector, we've been looking for commitments that would help Americans make healthy choices really across each of the pillars, but just to focus on a few. Mm-hmm. Under Pillar 1, which is improving access and affordability, we've encouraged the private sector to support students' health by developing foods that are more nutritious and affordable for school nutrition programs, and to consider raising awareness and promoting participation in USDA's new summer meal options. Under the second pillar, which is integrating nutrition and health, we've encouraged health insurance companies to expand coverage of nutrition services and to consider partnering with retailers and independent grocers to make healthy food like fruits and vegetables more available at a lower cost through efforts such as some of the produce prescription programs. And then finally, under Pillar 3, which is empowering all consumers to make and have access to healthy choices, we've encouraged retailers and other members of the food industry to make the healthy choice, the easy choice, both online and in their stores, as well as encouraging food manufacturers and retailers to consider to evaluate how healthy their product portfolio is as well, and to market and some of their healthier products as well. And so those are just identifying some opportunities that we see from some of the new commitments that we're looking forward to announcing, but also ways that we believe that the private sector and civil society in general can help us to achieve the President's goal of ending hunger and reducing diet-related disease.
Terrific, terrific. One final rapid question. You've got a engaged, committed audience here in the room, watching on the live stream. You can make an ask. What do you need from our audience to help you continue to advance the goals of the President's strategy?
Yeah, well, as I've kind of reiterated here, we're still working on the White House challenge to end hunger and build healthy communities. Just highlighted some of the areas where we are looking for commitments. We have, we are kind of reaching that final phase, but we, of course, are happy to connect with anyone who is interested in making a commitment along those lines. We continue to host a monthly update call for stakeholders as well, to both mark the progress that the administration is making and to lift up commitments that have been made and the progress that external partners are making. And so would also encourage folks to, if you're on our email list, to share that far and wide. We want more folks tuning in, keeping in touch with us. And if you're not on our list, we can certainly change that as well. But just one final just word of thanks here. This conference was a long time coming, and it really was made possible by leaders like all of you in this room and folks who have advocated for these issues to really be in the forefront. And so we're just incredibly thankful both for this opportunity to partner with you all, but also just the enthusiasm, the energy that we've seen from partners across the country who are rolling their sleeves up and are excited to help us solve these really important issues. So just thank you for all the work that you're doing, and we look forward to continuing our work with you.
Thank you, Will. Thank you for joining us. Thank you for just sharing the updates, and we look forward to continuing to work with you. Please join me in thanking Will McEntee from the White House. All right, we are going to now transition to our first panel, our federal panel. So I'm going to ask my other federal colleagues to step on up to the stage and just provide us just a brief moment to get settled here. And Jim, I think you're in this seat here. And Kari, you're in the middle, yes. Just a moment of transition, yes. All right, great. Well, I'm now pleased to turn our conversation to how the federal agencies, you heard Will speak of really the whole of government approach that's being taken with regards to reducing diet-related diseases. And so delving in a little more deeply now into looking at the federal agencies' actions and how they're working to address the goals of the National Strategy on Hunger, Nutrition, and Health. I'm really honored to be joined by three incredible panelists. They each have critical leadership positions within their federal agencies across government. to promote and protect the health and well-being of the nation, and specifically with a focus on healthy nutrition and physical activity. So first, to start out with introductions, I'd like to first welcome Jim Jones, who's the Deputy Commissioner for Human Foods at the U.S. Food and Drug Administration. As many of you may know, Jim just started this role 2 weeks ago. So he is the inaugural Deputy Commissioner for Human Foods at the FDA. We're very excited to have him join us today. Not new to the federal government, but 2 weeks in at FDA. Our next panelist is Dr. Kari Cotright, who is the Director of Nutrition Security and Health Equity at the U.S. Department of Agriculture, and thrilled to have Dr. Cotright, who has been really championing the work of USDA, especially prioritizing equity across the nation. And our third panelist, a longtime colleague, Dr. Ruth Peterson, the Director of the Division of Nutrition, Physical Activity, and Obesity at the Centers for Disease Control and Prevention. Please join me in welcoming all of our panelists. So maybe if we can start with kind of a big picture question. You know, as I shared, each of you really leads an important component of the federal government's work as it relates to all of these issues and promoting food and nutrition security across the nation, improving health. You know, given that we're thinking about these past 2 decades and how we move forward, I'd like to ask each of you if you could provide some thoughts on a big question, the current health of the nation, and the most pressing concerns that you're seeing from your perspective within your agencies and your specific positions. Ruth, how about we start with you and then go down the line?
That's great. Thank you, Nadine, and thank you for this great opportunity, and thank you for joining everyone. Thrilled to be here from CDC, and I'll tell you what keeps me up at night about the state of our country. And if you could flip back to the map that shows the red zones for obesity, as Nadine talked about, where 35% or more of those adults self-disclose that they are struggling with obesity. So the red map was scary enough, 22 states in 2022. The terrifying news is about the disparities that we see. So when you look at this map with the breakdown of the racial and ethnic groups, the states, 38 states have blacks have 35% or more obesity, 35. And then 38, and then 33 for the American Indian, Alaskan Native groups are greater than 35%. And then we get into the Hispanic rate, which is also in the 30s. Compared to whites, 14 states are over 35%. So this is what keeps me up at night, because not only is this an illustration of the obesity, but this map mirrors chronic diseases as well, and disproportionately health and well-being. And it's just sad because it drives depression and lack of willingness to be happy, and it drives healthcare costs $173 billion a year, just in healthcare costs related to obesity. So it's more populated in those red zones and in those populations that live in those red zones. So that's what keeps me up at night. And what is really interesting to me is we know how to prevent this. We know what works. But we haven't established communities where these red zones are to allow those individuals to get access to healthy nutrition and allow them to get access to safe and convenient physical activity, which Will didn't mention, but it was the 4th pillar of the plan, so I'll talk a little bit more about that. But that's what keeps me up at night.
Thank you, Ruth. Kari.
Yes, thank you for those statements as well, Ruth. And as I think about it, and we just heard about the White House conference, and those goals are very broad, so I just think they're worth saying again: to end hunger, to improve nutrition and physical activity, and to reduce diet-related diseases and disparities. And so if we're working on all of that together, I think I'm encouraged, just the thing you said to focus on, I'm encouraged that we can work together to solve these issues. And so as what we're doing at USDA is, a year and a half ago, Secretary Vilsack started a nutrition security initiative. So if you have not heard of nutrition security, it really means that everyone in our country has equitable and consistent access to healthy, safe, and affordable food. And we're not abandoning our work on food insecurity. It just means that we are working to make sure that everyone has the healthy, safe, and affordable food that is optimal for their well-being. And that change is inspiring to me. And so as we think about that, we know that during COVID, we saw that many people did not have access to healthy food. We saw the disparities increasing, and we know that there are structural inequities that prevent many people in our country from eating healthy food and being physically active. And so one of the things that the Biden-Harris administration has done is to really push federal agencies to think about their policies, programs, and practices. And at USDA, we're doing that. We formed the first ever equity commission, and our departments have equity plans, and that's so important. We are also prioritizing equity every step of the way and thinking about how to address the social determinants of health through our nutrition security initiative. And we want to make sure that we are improving nutrition throughout all demographics and life stages. And that is so important for our work. Core to our work is our 16 nutrition assistance programs that we are so proud of. We serve 1 in 4 Americans, and we know we can serve more. We want everyone who is eligible to be enrolled in our programs because we know that they are powerful and they work and they reduce healthcare costs. And so as I think about that, I'm inspired by the work that we are doing. Just the fact that there's a role called the Director of Nutrition Security and Health Equity at USDA shows the push and how we're moving forward. But I'm inspired to partner for change.
Thank you, Kari. Jim, please.
Well, so you may or may not know that the Food and Drug Administration has a broad remit as it relates to food safety in the United States. The commissioner announced about 6 months ago a reorganization because of a fair amount of criticism about how we were doing in a number of areas related to management of foodborne disease, the management of chemical safety in food, but also the creation of a Center for Nutrition, because he recognized that there are extraordinary public health benefits that we were not capturing as it relates to nutrition, as it relates to the issues that you've outlined in your report today. And so we are very committed to raising not only the profile, but the energy that we're bringing to this area, because we feel that the potential for the improvement in public health benefits associated with improving nutrition, they're extraordinary. They're extraordinarily high, and we've got to do a better job of capturing those benefits. And so we'll be talking a little bit about today about some of the things we're going to be doing in that area.
Terrific, terrific. You know, each of you, and since we started this conversation, we've been talking about the disparities, right? And it's so critically important that equity is central in the policies, in the programs, in the decision about resources. And when we look at this across nutrition, obesity, diet, and other chronic diseases, we see, Ruth, you talked about the disparities, and we showed the maps of the rates that we're seeing and extrapolate that's consistent across chronic diseases. So if you could dive further in, you know, describing specifically the intentionality you're having to address the disparities and how to advance health equity. What are some of the strategies and approaches that you're using, whether it's under the auspices of the national strategy or other mechanisms that you have within your agencies to truly advance health equity? Kari, let's start with you. You talked about the Equity Commission, for example, at USDA.
Yes, and we're also working. Last fall, we had our USDA Economic Research Service, and they had the National Annual Food Security Report. And it showed that 35 million Americans struggled with hunger in 2021. But we also saw a decrease of 5 million who were food insecure. And so that's very encouraging. And so as we think about that with our food insecurity, we also had a decrease in the number of households who were food insecure that had children. And so that's encouraging as well. And so what we know is that to impact those disparities, that our programs are effective, that they help to do things. And so as we think about that, they help to combat hunger. Our programs like SNAP, the skills that people get from our programs like SNAP Ed, our programs such as WIC, and also thinking about things that we've done such as reevaluating the Thrifty Food Plan, which determines the amount of SNAP benefits that our participants get. And so we are making sure that our evidence base is grounded in science, and we are making sure that our programs are making that healthy, safe, and affordable food accessible to the public. And so we know that there are many people who can benefit from our program. So I'll just go back to saying we want to ensure that everyone who is eligible is enrolled in our programs. And then having me in my role, we are also able to go out and engage with stakeholders, both internal and external, to partner to reach these goals. Because as Will said earlier, we can't reach these goals alone, but we are really laser focused on making certain that we prioritize equity every step of the way. And my role is to do a whole of department approach. I work across the entire department to make sure that we are advancing efforts on food and nutrition security and making sure that we're integrating health equity in everything we do.
Terrific. And I'm Kari, going to come back to you to talk a little bit more about some of that work specifically around food and nutrition and security. Jim, if we could turn to you, FDA's approach. What is the approach to advance equity through the FDA's lens? Yeah.
So we are fundamentally a regulatory agency, and what I have learned over many years as a regulator, if you're going to capture an issue like equity into a regulatory program, you have to do it at the very beginning in the design up front. And so when you are trying to figure out, for example, on front of package labeling, which we heard a little bit about, and I can talk some more about, you're basically trying to grab a consumer's attention in the split second when they're making a point of purchase decision and influence that decision with information. Well, if you're going to have a bunch of academics in Washington sit around a table and design what that's going to look like, there's a reasonable likelihood it's not going to speak to everybody you're trying to reach. So what we're doing is in the design of the front of package labeling, we're also doing this with our work on added sugar, is reaching out to communities, oversampling communities that are underserved, that are disproportionately impacted, finding out what speaks to them so that when we ultimately select the label that we will rely on, we'll have confidence that we're going to speak to the populations that we're trying to speak to. Now, the real trick in this is that it's going to have to be a label that speaks to everybody, but we're not going to leave out some of the target groups we're really trying to reach. And so we're doing it in design. Before we get to the end of the selection process, we're picking which label to go with. We want to have confidence that we actually the version we're going with is going to reach the community that we're most worried about, and that is underrepresented and overburdened, disproportionately impacted communities.
Ruth, you said what kept you up at night. So
Yes,
how do
that's
we, how do we,
it.
so-
Okay,
how do we
yeah.
solve what's keeping you up at night?
So I think health equity is the goal. It's why we come to work every day in public health across the country at our state and local public health, and it's why we come to work at CDC. And our problem at CDC and in state and local public health is we have the data, just like I showed you on the map, to show you where the health outcomes are the worst and well-being is the worst. So that defines the disparity, but then you have to figure out what to do about it. And I love where you're going, Jim. You can't just tell people what to do about it. You have to have this bi-directional loop between the ground level, the state level, the federal level, and everybody has to be pulling the same way with their eye on achieving health equity, but particularly on what disparity are you looking at. Disparities were not created in the last 10 years. They've been here for hundreds of years in this country, and every decision we've made in this country leads to the disparities we have today. So when we fund communities and states and we say, fix the disparity, that's actually impossible because you're trying to work against 400 years of policymaking. And even the nutrition changes we've made since World War II in this country, we have the food system that we want based on what happened after World War II. So in order to address the disparities, we have to be very strategic, figure out the policies, figure out the levers, make friends with FDA and USDA because they help us too, make friends with local community members who can remind us to be honest and say to us, that's not going to work for our population. Let's think about culturally tailored recommendations. So it's hard work, it's messy work. You have to always listen, but you always have to be based in what is the evidence saying and make sure that we stay true to what the policies are. And the White House strategy takes us with a guiding light that direction. And so now it's all of our jobs to implement that.
Thank you, Ruth. And I'm hearing from both of you just the importance, certainly the interagency work that you're doing. This can't be a siloed approach. but then certainly also ensuring that you are partnering really with community. And from design phase, as you described, we're going to hear in the next panel some of the work from leaders in the community, really that gives us the tangible ways that this is actually helping to promote health and address health disparities. You know, if we can go further in, Kari, you mentioned a series of programs that you are helping to oversee, that the agency is implementing, the breadth of ways in which USDA actually helps to provide nutrition support to American families all across the country. You know, both you and Jim are new in your roles. You're still within your first year, but you're already demonstrating that impact. If you could dive in a little further into some of these programs, whether it's SNAP-Ed or WIC, and talk about specifically how you're seeing progress and what do you want to strengthen now that there is this role? Because a lot of times when we're talking about equity, leadership is needed, right? Now we have the leadership. So tell us how you're doing this and what you need to strengthen the impact that you can have at the agency.
Yes, we have some exciting work going forward. And so with our Food and Nutrition Security Initiative, we really want to make sure that we are addressing those structural inequities, that we know that people don't have access to healthy, safe, and affordable food, so making sure. So I'll dive into the programs, but I want to give a breakdown of our four-pillar approach. And so first is having meaningful nutrition support throughout life. And so as we think about that, we think about SNAP. And so we think about our SNAP program, and we have our SNAP-Ed program. And so the SNAP-Ed provides education, and we just had a new branch development leadership specifically for SNAP-Ed. And so making sure that we are addressing the needs of our participants and our consumers, and just making certain that everyone not only has that access to healthy, safe, and affordable food, but they have the skills and the knowledge to prepare the food. That's so important. And I think about that as well as a registered dietitian. Next, having that access to healthy, safe, and affordable food, right? Just making sure that they're able to access the food and in being enrolled in our programs like SNAP and WIC. And WIC is our program that serves children ages 0 to 5 and also mothers who are pregnant, postpartum, or lactating. And so what that does is it gives our mothers breastfeeding support, it gives our children access to more fruits and vegetables, and it gives them better opportunities to get that supplemental food that they may need to thrive. We know that it works, and WIC serves 50% of infants in the United States. And we know that the mothers and the children who are enrolled in WIC are also eating healthier. They are choosing to eat healthier. So when we think about that, we know that our programs have many impacts. Another program is the Child and Adult Care Food Program that serves child care centers or the early care and education setting as well as adult care settings. And so we know that people who are participating in these programs, or the people that are running the programs and participating in the Child and Adult Care Food Program, are also serving healthier foods and beverages. And so as we are working to do that, we want to have those critical public health impacts to show that our programs are valuable, to show that they reduce healthcare costs, and that is so important. Another thing that we're doing is making sure that we are translating the science into what we're doing. So a part of our work is the Dietary Guidelines for Americans, which are being revised right now for 2025. And so as we think about that work, we want to translate that into things like My Plate. And as we think about, if you've not heard of My Plate is our federal symbol for healthy eating. I happen to be the My Plate policy official, and we are I certainly am.
Not surprising.
And we are working to make My Plate a household brand. And that is one of Secretary Vilsack's core priorities. And one of the things that we just did, I just came back from the Academy of Nutrition and Dietetics Conference in Denver, and we held our very first My Plate Town Hall. So just like Jim and Ruth were saying, we are hearing from consumers about how are you using this tool? What would make it easier? What barriers do you have? Because we want to use it as a guide, and our team, our Center for Nutrition Promotion and Policy, has made wonderful resources. We just have to make sure that people know about them. So there's so many ways that USDA is making wonderful and critical public health impacts through the work that we're doing through food and nutrition security.
Kari, if I could ask you to just excellent data that you provided, resources. She's also sharing an opportunity to the audience to inform the dietary guidelines for Americans as that's being developed. Specifically around SNAP, so much national attention around this program. Can you share with us, just as you did with WIC, talk a little more about the impact, the role of SNAP in this country, the Supplemental Nutrition Assistance Program, both from a health as well as economic perspective.
Absolutely. And as we think about, again, I'll go back to that economic impact. So we know that with our SNAP dollars, that we reduce healthcare costs. If we make a small investment through our SNAP dollars, it returns to us and reduce healthcare costs. And so that is so important. And as we think about the strides that we're making in terms of reaching our communities and reaching our participants, we want to make sure that they are able to get the healthy foods that they need. We are also making certain that we are considering their cultural food preferences and their dietary needs as we're working through our SNAP initiatives. And so having our team dedicated to that work, making sure that enrollment is easy, making sure that we meet the needs of the community is so important. And I'll say a little bit more about some more of the things that we're doing in terms of the impacts in the next question.
Terrific. Jim, I know you're 2 weeks on board at FDA, but share with us some of your early thoughts around as you're shaping the vision for what's been proposed as a unified food program. There's a lot of interest in that. Can you share with us already what some of the early thoughts you're having around your vision for this program?
Yeah, and thanks for that question. And some of it has to do with nutrition, as I was mentioning, and raising the profile, bringing more energy to it, seeing if we can capture more of these public health benefits related to improving nutrition that can reduce disease and all else attendant with that. Other elements of the vision, though, have to do with what is many people have traditionally thought of as the remit of this program, which involves we just need to get better and faster at addressing foodborne illness in this country. It is still a significant problem in this country. There's been a fair amount of criticism of the speed with which we are operating. Part of this reorganization was designed to help us become faster, to take out redundancies, increase the speed with which we're able to respond when a foodborne illness occurs in the United States. And the other area is to increase the attention that we give to chemical safety in food. There are chemicals that we allow in food, and doing a better job of identifying chemicals that may be of concern and then taking action if appropriate. But another part of it is how we do this work. And as we've been hearing throughout this panel, I see the food safety, nutrition, as well as traditional food safety in terms of foodborne illness is an enterprise effort. It is not just FDA. We're not the only player on the table. We have federal partners who we need to be working with. We have state partners who often have, when you aggregate them, as many resources as we do, that we have to be collaborating with them to make sure that we're getting as much done as we possibly can, not competing with them. There are local officials that we need to be leveraging. And so thinking of the entire enterprise and being more coordinated so that we can get more done. And the last piece I would say is stakeholder involvement. You just cannot do this kind of work in any of these areas without meaningful stakeholder involvement early in your process, not late in your process. Late is too late. Something is already cooked and it's baked and there's really little you can do but maybe change the color of the frosting. But you get in there early and you can really meet our legal and regulatory needs, but do it in a way that optimizes it for everyone in society, whether it's the consumer or the industry that we're regulating. And so getting earlier stakeholder input, whether we're talking about nutrition or we're talking about a potential restriction on a chemical or we're talking about changes in the way in which we manage foodborne illness.
Just a lot of receptivity in particular with regards to stakeholder input from all of your agencies. Ruth, you have been leading an important program, one of CDC's main programs to address nutrition and physical activity, which is the State Physical Activity and Nutrition Program, the SPAN program. You talked about the fact that we know what works. They're proven programs that actually can help to address obesity. But what we also know is that that program has enough support to be able to reach 17 states. Part of the national strategy on hunger, nutrition, and health is calling for that expansion of the program to be able to reach all states and the U.S. territories. Paint a picture for us of the impact we can be having if we could actually see that type of scalability of a SPAN program that has demonstrated impact.
Thank you, Nadine. And it was included in the national strategy because what the White House did with their investigation as they designed that strategy was they wanted to know what is already working and how can we help you expand those things or enhance those things that you know work. So they didn't need new things created. They needed to know from federal agencies, where can we help you cross something into the next tier of success. So as Nadine said, we have enough resources from the congressional lines to fund 17 states, and every state in DC is interested in receiving this funding to the state health departments. And then they work with their local communities to get this bi-directional feed between local communities and the state department, and they work hand in glove so that you can have state policies that improve access to nutrition and to physical activity. And those are aligned then with federal policies that CDC can work with the key partners in. So there's a win-win-win. So right now we have 17 states that are winning, which means that we have a lot of states that are not winning. And in fact, I'm making the disparities worse in this country, because this competitive funding that state health departments or their designees come after, and the top applications win, and the lower applications that are all what we call approved but unfunded. They're all fabulous, but we can't fund them all. So we have those sitting on the shelf, but we can't fund them. So what that means is, I just finished a 5-year funding agreement with SPAN, had 16 states, and we can show huge outcomes that improved access to nutrition and increased access to physical activity, especially in areas that are disproportionately affected by poor health and chronic disease and obesity. But that means the other 34 states I did not fund have gone backwards because they did not have funded staff in place to drive the policy change and the strategic thinking that needs to happen. What I said earlier, this can't get fixed overnight. We've been in this for years and years and years, watching things go the wrong way around nutrition and physical activity. It takes 20 years to change your master plan for your community to improve access to safe and convenient physical activity. Because think about how we've designed this country, that we designed it for cars and we designed it for cul-de-sacs. And those are not promoting pedestrian and walkways, and Louisiana is going to tell you how they're going to fix everything in the next panel. So, but it's a great example, and listen to Louisiana, because they are here because they had technical assistance from CDC and funding, and all the other states that didn't have that have fallen behind. So I made the disparities worse. The White House strategy had a $72 million ask that was in the president's budget to fund all 50 states, the territories, and DC for SPAN. And that was because they realized that was how we were going to implement what we know works with the influence of the state health departments and their local counterparts. It also included an initiative for Active People Healthy Nation, which is an initiative we have at CDC and many partners to increase physical activity by 2027 for 27 million more Americans. So again, to do that, we have to have the changes in master planning. We have to have complete streets implemented. So again and again, I can show I've helped millions of people get healthier over the last 5 years, and I will with the next 5 years of funding, but I will not do it with 33 other states, DC, or the territories. So that's why the White House had that in there, and I really appreciate the $72 million ask from the President of the United States. So I do have that page framed on my wall.
Thank you, Ruth. Just so compelling, and you know, for those of you that either have read or will read our report, this has been a central policy priority as well for Trust for America's Health is the expansion of the SPAN program, because again, it's the understanding that we have programs that work, but having the resources for public health departments to be able to implement this, to engage in the partnerships, how critical that is, to be able to assure that all communities, that it doesn't depend on your zip code as to whether or not you gain access to these programs. Kari, last year, USDA issued a proposed rule to strengthen and enhance WIC benefits. Can you talk to us about, you've really highlighted the impact of WIC. Are there aspects of this proposed rule that you really want us to have an understanding of that's going to help to advance maternal and infant and child health moving forward for the nation, and what that means then for the overall health of the nation?
Yes, and so as we think about maternal health outcomes, we know there are market disparities. And so the WIC program is helping to address that. And since 1972, the WIC program has been helping to improve the health. Like I said, I'll repeat it just to make sure we know the pregnant mothers, lactating mothers, postpartum mothers, and infants, children ages 0 to 5. And so as we know that it's a meaningful program, and we know that it's an evidence-based program. It has been working for so many years, and we know, like I said, that these participants are more likely to be eating healthy. So as we enact the latest nutrition science, we know that only about half of the families that can participate are enrolled, but we have seen a lot of increases. And so that's very, very encouraging. Participation increased for the first time in 2022, and by 2024, we expect to have 6.7 million participants. And so as we are increasing our rates, we're going to need funds, to make sure that we are able to serve our consumers. But as we think about our participants, again, I'll just outline some of the wonderful impacts that WIC is having. So making sure that our new proposed changes are allowing our mothers and our children to have access to more fruits and vegetables, making sure that their cultural food needs and their special dietary needs are addressed, making sure that there is breastfeeding support, because we know how beneficial that is for brain development and health for young children, for infants, and even adding a provision for canned fish. And so as we think about that, and we think about WIC and its long evidence, the evidence that it shows on how it is improving the health of mothers, we know that it will also have a long-term impact on maternal health outcomes. And that is so important to address disparities. And we know I've had so many stories and personal, I will say, interactions with mothers, especially Black mothers, who have experienced very negative birth outcomes or birth experiences. And I've even from CDC, lost a very close friend at 36 years of age, who had the best insurance in the world and worked for CDC, Shalon Irvin, who passed away way too early because of maternal health issues. So anything that we can do to impact healthy moms and healthy babies, that is what we are working on, and we want to work to make sure that everyone that is eligible is enrolled.
Thank you, Kari, and thank you for sharing the story. We've been talking and sharing a lot of data, but behind these data, not behind, at the center of these data are people and communities. And so having that and an understanding of why we're so motivated across all of our sectors to really improve health and well-being. Thank you for sharing your own personal experiences of colleagues and friends who have been impacted by this as well. We've been talking about access and equity and programs and policies. Let's take a step back and maybe speak even to the broader food system. And Jim, you talked about this even in the vision that you have around the unified food programs and talking about creating this healthier food supply. You've talked about front of package labeling and some of the other nutrition initiatives that the FDA is currently leading. There's a lot of opportunity here that the agency is pursuing to really think about how do we create a healthier food supply. Can you talk more about whether it's the front of package labeling, the voluntary sodium targets, about how we create that healthier food system?
And I like the way you frame it, Nadine. I've been trying to do the same thing. Food should be a vehicle for wellness, not illness. And so much of what we spend our time is on this managing of the illness part, which is hugely important. It's eliminating the illness that's going to get us to the wellness, I recognize. But so we have a number of activities going on. I realize that sodium is not necessarily related to obesity per se, but it certainly is related to diet-related disease in this country, significant diet-related disease. So, and one of the things that has given me hope in this space where there's so much negative data about what's going on in the trends is that we have seen countries like the UK and in the United States itself where voluntary targets, which I'm always very skeptical about voluntary targets as a regulator, voluntary targets around sodium. Early data here in the United States, our first target, the date to meet the target is next April. The early data we have, it's not incomplete by any stretch, is encouraging. Things are moving in the right direction. The UK, which is several years ahead of us, similarly had a short-term target for sodium reduction. They have even shown more thorough results, that they are reducing sodium content in food. We think that there are dramatic public health improvements available by reducing sodium in food in a way that if we do it well, which is a slow glide, the consumer never even notices it. Their health gets better and they didn't notice that they were consuming something that they may have not liked as much. They'll like it just as much. So that I think is very encouraging. We have, and you heard it earlier in the first panel, the designation of healthy, that there are foods that can qualify for having healthy on the label. We are going through a process right now. We've already proposed a rule. There had been a rule that's been in place for a number of years. We think there are some problems with it, that there are some foods that we actually today wouldn't consider to be healthy per se, that will not be allowable. They will not be eligible to get that label going forward when we finalize that rule, which we have to do next spring. And then there is the front of package labeling, where what we're talking about here is, for those of you who haven't really followed this, is that there are a number of ingredients in foods that can be meaningful contributors to illness, diet-related illness. I mentioned sodium, saturated fats, and added sugars. And so is there a way to communicate very simply, and when I say very simply, in a way that is truthful, but it's meaningful in that split second that a consumer is making a decision at the point of purchase? We're not trying to sort of like create some scheme that you've got to do research on the internet before you get there. You don't have to sort of do a bunch of work while you're in the grocery store, because we know that's not how people shop. They're making decisions in a split second. Can you present information around those three things that, if you're getting too much of them, it is going to cause you problems, whether it's through hypertension or obesity and other problems that will ultimately limit your life. Can we convey that information in that split second? And that's one of the issues that I've been talking about a little bit earlier. And I think it has some very significant promise. Again, we've seen other countries around the world implement systems, so obviously we're looking at them because they've already done it. But we also want to make sure it's tested here. We want to make sure we're testing the communities that we've been talking about in this country, people who do not have access to healthy food, people who are overburdened in their diet and diet-related illnesses, so that we're speaking to them as well, and not just relying on something that was created in another country that may not have similar issues. So, and countries who have implemented front of package labeling have seen significant improvements in the diets of their citizens, which we think over time will show in significant improvements in the health of their citizens, which at the end of the day is what we're trying to achieve.
That's right. Let's open it up for audience questions. You've all been sitting patiently to see if there are any questions from our audience, whether in the room or online. We've got Caroline, who is walking around with a microphone. So if you just raise your hand if you have a question in the audience. Any questions? Or online, I should say. There's an online question I see. Go ahead. Thank you, Madison.
Hello. Thank you so much, everyone. So this is a question from the virtual Q&A. This might be best answered by Dr. Peterson and then Dr. Cotright. So the person was hoping to learn more about the challenges in data collection for obesity rates for people of Native Hawaiian, Pacific Islander, and other Asian descent. And then for Dr. Cotright, similarly, to understand the efforts currently underway to include diverse perspectives in formulating resources like MyPlate and making sure that it's applicable to people.
Yeah, so the maps that were shown with the different racial and ethnic groups we have to combine multiple years of data to get those numbers, because when you do a survey that is voluntary, which the behavioral risk factor survey is, you have to make sure that you have enough data so that you're not making generalizations about a group because the numbers are small. So we also want to acknowledge that self-reported data. So if we really wanted, so we consistently think about how can we collect data that's meaningful to drive action and to show the improvements in a place where we intervene. And having those racial and ethnic differences is critical to our understanding to do the right thing, to address those disparities. So we're investigating a number of possibilities, including working even with the healthcare setting. So we have a Family Healthy Weight program, which is a USPSTF guideline-driven program for addressing childhood obesity in a family-centered way that has 26 hours of supportive counseling and work with those families. So even with that, we want to make sure that we're tracking improvements in weight status or weight maintenance for those children. And we want to make sure that we're doing that with racial and ethnic groups, or with urban and rural, or with low SES, and so all sorts of different disparities. That's really difficult. So BMI is something that we use as a screening tool, and we have the children growth charts that CDC puts out. So we track with those growth charts whether or not a child's weight is progressing in a fashion that will promote their health for the rest of their life, which I want to echo what Kari said. We start early. Like when we think about obesity and risk factor reduction, we think about it when those children either have breastfed or they get nutrition from formula. We think about their taste buds. So you're introducing foods when you move off of breastfeeding and when you move off of formula, you're introducing what we call complementary foods. And if they have sugars in them or they're high in salt, guess what those kids like? They like things with sugar and salt. So I'm getting in a rabbit hole based on your question, but I appreciate your question, and it's very complex, and we need that data around children's growth patterns so that we can identify where we have areas where we know our interventions have worked. We released the first ever state data on sugar-sweetened beverage intake for kids, 0 to 5. State data. So again, it's tied to where we know the obesity rates will be higher, and the state data on sugar-sweetened beverage intake would horrify you. So that for us is a complex array of how do we track weight, how do we track the risk factors for weight, and how do we make sure that at the same time we're tracking those things, we're looking at the policies we need to implement to be really specific about how to reduce the risk.
Thank you. Thank you for that question. One of the things, I'll go back to SNAP and our SNAP Ed branch. And so we have a new branch, as I mentioned, dedicated to SNAP Ed. And we also have our InPair system, which is just an abbreviated system for collecting data so that we can really show the impact of SNAP in an effective manner. And so it's a totally new data system. And we're also doing an equity evaluation of our service delivery. And so making certain that we're doing that and that we are collecting sound data to show the impact. I'll turn back now to, because you also asked about MyPlate and MyPlate resources and cultural adaptations. So one thing we have is a MyPlate National Strategic Partnership. So if you're not a part of that and you're interested, please reach out to me and I will connect you to our CNPP team to help to make certain that you can be a partner. We have partners from grocery retailers from all over the country who are really working to help us to promote MyPlate. And being a part of that partnership is important because, as we've all said, we can't do the work alone. We also have a comprehensive MyPlate promotion plan that we are working on. MyPlate is now on Instagram, so if you have not done it yet, whip out your phone and follow MyPlate on Instagram for many, many resources. And we are also working with that MyPlate Town Hall, the listening sessions that we are doing. We want to hear from people about their needs, about their cultural preferences, and how we can have adaptations of MyPlate so it can serve communities of all demographics and all life stages. We want to make certain that we're doing that. So our team already has numerous resources. Our partners have tons of resources as well. We have Mi Plato, which is a translation of our MyPlate resources into Spanish for our Spanish-speaking persons in the country, and we are just really working avidly to make sure that we hear from consumers so that we can make sound adaptations, because we know that MyPlate is a translation of the dietary guidelines, which are grounded in science. So that really drives what we're doing, but we want to hear from you, and so please do reach out to me if you are interested in those, and we will be announcing more of our MyPlate Town Hall meetings.
Yes, we have a question up here.
Yeah.
Caroline's coming over with the mic. Yes, thank you, Caroline.
Well, first of all, thanks for a terrific
And if you could say your name and
John
organization.
Auerbach from ICF. Terrific panel. In the last year, there's been, or maybe it's just the last several months, there's been a lot of attention to medications that offer promise in terms of people who have struggled with obesity. And I think sometimes the media has given the impression that that will solve the obesity problem simply by prescribing medications. And clearly it's much more complicated than that. But given the attention that that's received and that now availability of approved drugs. How do you see medication fitting into the overall efforts to reduce obesity?
Would you like to start?
Sure, I'll start. I think it's a part of a complex puzzle. So obesity is a complex disease, and it's oftentimes not just because of what you're eating. There's all sorts of things individuals' bodies do to increase their risk of struggling with obesity. And we need all the help we can get. So my goal is to design communities so that people reduce their risk of long-term obesity and they can live healthy lives and their children can grow up strong, and we can have recruits from the military, and we can have people that have incredible brains going into science and public health. But there has to be other solutions that are part of that complex puzzle. And we also have to make sure that it's equitably available. So there are distinctions sometimes in reimbursement for that. So it's all hands on deck. Any solutions are appreciated, but I still want communities to promote nutrition that is healthy and culturally tailored, and where you can get physical activity.
Thank you. Thank you. One last question from the audience. Any other questions?
One more.
Umair Shah, Secretary of Health of the great state of Washington, and also a member of the board for Trust for America's Health, and a proud member of ASTHO, the Association of State and Territorial Health Officials. Thank you for the wonderful panel, and just wanted to really recognize this pandemic that this last 3 years has been so difficult, and obviously some of the data are going to be coming forth about how that's impacted children, in particular when it comes to chronic diseases, conditions, including obesity. There was, as we all know, a lot of politicizing that went into what we have experienced over the last few years. The question I have is really about this movement in the field of obesity and science about weight, which, not to draw us back into a politicized arena, but really this challenge of how do we talk about weight, how do we talk about weight in a way that people understand a factor, important factor, not the only factor. How would you really level set for all of us that emerging area within the field of public health? Thank you.
Thank you.
Go ahead, Nadine. No, just kidding.
We're both grappling with that. Yes, Ruth.
So the first thing that CDC stands behind is not stigmatizing anyone based on their weight. And so we have to be very careful with people who are interacting with people who are struggling with weight issues, that they do not feel bad. It's not their fault. We need to really be careful with that. So anything that we do, especially with the American Academy of Pediatrics, is work on the clinical practice guidelines to make sure that interactions in a healthcare system need to be positive. And you need to be emotionally intelligent about that, and you need to make sure that you don't do damage. And you also need to step back into the world of ACEs, so adverse childhood experiences, and all of the bad things that people bring to a physician's office or to any sort of behavioral health person. So not to blame people. So we cannot blame individuals in this country who are struggling with their weight because they probably didn't plan that. Again, it's about their environment and it's about the decisions that they made. Yes, it's become very political in how we talk about it and in how we talk about even our data, because why do we keep showing bad obesity data? It's just making people feel bad. It's meant to be a science-driven action where we have to show the burden and then we have to rally, again, with USDA and FDA and NIH and all sorts of agencies and state health departments and local and politicians to make sure that we're not blaming the wrong person. Let's blame the systems that got us here, and let's work collectively to address, as Nadine opened with, some of the structural issues that have created this problem. This is not the individual's fault. And I know people are triggered oftentimes when they have these experiences and it becomes a front page newspaper article. So we have to work in clinical practice guidelines. We have to work with teachers. We have to work with people who are employers to not have a bias against people who are struggling with their weight. It's a whole mindset. And we're up to the challenge, and we do not mean to make people angry. We are here to actually improve people's health and make them healthier and feel better and be able to be a recruit for the military if they'd like to be able to go to college, be able to get a job, be able to be a productive citizen, and to not have their children lose brain development because of an environment they're in, because that's the whole next generation. So I'm happy to talk to you afterwards. I hope that got to your points, because we all have to do this together. We have to listen to each other, and we can't just get mad at each other, because there's already enough of that going on around in this world. So let's just solve the problem together. And with FDA saying we're going to work on reducing added sugars, and USDA changing their regulations on WIC to reduce added sugars, and our data on how much the problem is, we have a lot of work to do. So happy to do it with everybody.
That's an excellent closing comment, Ruth, to say we've got a lot of work to do. We're happy to do it together. And I'll echo to Ruth's point, from the vantage point of an organization such as ours at Trust for America's Health, it's clearly communicating really the structural inequities and barriers that exist with regards to achieving and maintaining a healthy weight. And it was actually Dr. Shah's question is great, because it's part of the topic of the next panel that we're going to have from leaders in the community, speaking about this in terms of understanding, yes, this is a public health issue, but how do you address issues of bias and stigma? So you're going to hear more about this in our next panel. But please join me in thanking our federal panelists. And I'll turn it back over now to Stacy to transition us to our next panel. Thank you, everyone.
All right, thank you, Nadine, so much. For our next session, I'm delighted to introduce another TFAH colleague, Dr. Takesha Everett, who will be facilitating our next session. Dr. Everett is TFAH's Executive Vice President. In this role, she works in partnership with Dr. Gracia to chart and implement the organization's strategic direction and priorities, provides counsel on current and emerging policy issues, and engages with key organizations, policymakers, and other partners to advance policy priorities and to improve public health and equity. Dr. Everett's career spans service in nonprofit, state, and private sectors. Most recently, she served as the inaugural Executive Director of Health Equity Solutions, a statewide nonprofit dedicated to advancing health equity through policy and advocacy in the state of Connecticut. Please join me in welcoming Takesha and our panelists for our next session.
Wonderful. Well, good afternoon. As you've just heard, we've heard from the previous conversations that we have a variety of activity that's going on at the federal level to address food and nutrition security and the rising rates of diet-related diseases. And it's all been spurred by this national strategy that you've heard a lot about today. In our report, we talk about not only the fact that federal dollars and federal investment is important, but that conveys over to state and localities. And what's most important in the process of doing that is ensuring that the people who are in the community and the folks most impacted by disparities and health inequities are making decisions about how that funding is being used at the community level. So this panel and this conversation is near and dear to my heart, because we're going to be talking about those community solutions and what's happening on the ground and perspectives around obesity and improving health and wellness. I'm honored to welcome our great panelists, who I've told them that we're essentially in my living room and that you all don't even exist here or online. They're going to talk to us about how they're leveraging CDC funding through the High Obesity Program in their home state of Louisiana, and also talking about some of the work that's being done from a physician perspective. First, I'd like to introduce Ms. Jamila Freightman, who is the High Obesity Program Manager at Louisiana State University Ag Center. Immediately next to her is Mr. Randy Williams, who's the co-founder and vice president of the Robinson Williams Restoration of Hope Community Center in Bastrop, Louisiana. I worked hard to get that right. And I'm also honored to welcome our third panelist, Dr. Kofi Essel, who is a board-certified community pediatrician and the inaugural director of the Food as Medicine program at Elevance Health. So thank you so much, and please join me in welcoming our panelists. So since we're in my living room, I started very formal with Mr., Miss, and Doctor. We're gonna go right now to Jamila, Randy, and Kofi, talking to Takesha. And Jamila, I'm gonna start with you first and ask if you would please share a little bit of the history of the HOP program at Louisiana, and specifically why it's so important to engage with land-grant institution and extension programs like yours.
Absolutely, and before I start, I just want to thank you for this opportunity to be here. This is the second panel that I've been on in my career, and I'm just really excited about this. We also did share some photos with TFAH, and I think they're gonna come across the screen. But to give you a little bit of history about HOP, we have had this federal funding from CDC since 2014. The purpose of the high obesity program is to implement policy, system, and environmental changes in rural communities and counties, and in Louisiana we call them parishes, with an obesity rate over 40%. And we do this by enhancing the food system, so really promoting nutrition guidelines and helping organizations implement nutrition guidelines, complete streets, ordinances, and policies, and also enhancing the built environment. So working with our partners to develop connectivity plans, and also working with them to implement those connectivity plans by leveraging resources from other sources and from other organizations. This funding was specifically provided to land-grant universities because the land-grant university system has been around for, I think, since the late 1800s, early 1900s, and so we really have a stable presence and trust with the communities. We understand the needs, we understand the assets, and so our agents, who are our fabulous boots on the ground, they are really the ones driving this work in the communities. And so we are also very knowledgeable about everything that's going on in these communities. Additionally, we are also a research institution. And so we like to say that we take the research and put it into practice in the communities. And so, and in Louisiana, we are very lucky. We do have 2 land-grant universities. We have Southern University as well. And so because of that infrastructure between the 2 universities, we have a presence in every parish in Louisiana. So that really helps with our outreach efforts and community building in Louisiana. And so with the research and evaluation that we're doing, we provide individuals, families, businesses, schools, local governments information, and that is aimed to improve the well-being, the economic conditions, and the quality of life in Louisiana. So that's a little bit of the history and why land-grant universities are essential for this work.
Lovely. And as a proud graduate of a land-grant institution, not in the great state of Louisiana, so we will not name it because this is about you today, I really understand that connectivity and commitment to community that land-grant institutions have. Like, you're mandated as the existence of being around to have that reach into the community, the understanding, and translating not only what's happening into the community into action there, but also into research, into using that to better understand these problems. And you mentioned that a core part of that is working with your partners. So could you talk a little bit about how Louisiana State University works with public health partners to prioritize rural communities and to advance health equity in Louisiana?
So generally, parishes or counties that have an obesity rate over 40% are in rural areas. And so that is the basis right there. But there are about 3 or 4 ways that we do this. I'll probably just touch on 3. And one of those is through a community-based approach. All of our agents are required to do community forums. They're out in the community developing coalitions, working on coalitions. And so through this, the communities are really telling us what their needs are and how we can use our funding to make improvements to the food system and the built environment. Additionally, we offer hands-on technical assistance. We have been partnering with the organization called the Center for Planning Excellence, we call them CPEX for short, and they are working with our communities to train them on what a complete streets policy is, what the benefits of that is, and help them develop these connectivity plans. And we are also working with our communities to do walk audits and other assessments. And we have a food system specialist, Mackenzie Miller, and she works with our farmers markets, our farmers market vendors, and small farmers to really help them learn, how do you become a SNAP vendor? What is the benefit of becoming a SNAP vendor to your business? How do you get reimbursed? So she is going around the state and doing these trainings with our partners in that way. So that technical assistance piece is really important. And I do want to touch on our Rural Complete Street Summit that we held at the end of last year. And we had about 12 communities that brought their teams. They had to have an elected official involved and other community stakeholders there together, and they received hands-on technical assistance from the Center for Planning Excellence, DOTD, and other transportation partners to really look at their connectivity plans and to help them apply for funding. Throughout the years, we have been working with HOP, for the last several years, and working with these communities to develop connectivity plans, and usually they may have a connectivity plan already or some form of plan, but it's kind of sat on the shelf. So I worked with our team and said, hey, can the communities use these plans to apply for DOTD funding? And so the last piece I'm going to talk about is how we leverage partners and their resources. And so I do want to acknowledge Dr. Jessica Stroop. She is our physical activity specialist, and so she was the one who really went down that rabbit hole, and we were able to leverage technical assistance from CDC to help her figure out how do we increase access to DOT funding. And so one of those funding sources was the Transportation Alternatives program. And so a lot of communities, well, actually not a lot. Previously, I think only one small rural community applied for this funding. And rural communities, they do face a lot of barriers when it comes to applying for funding because it can be very expensive. And it's because of the match requirements. They also have to come out of pocket for design and engineering cost. And so through the technical assistance and Jessica's work, she has convinced, I'll say, DOTD to reduce those barriers. So they reduced the match requirements from 20% to 5% for communities under 5,000 and 10% for communities between 5,000 and a little under 50,000. And so that has really helped more communities gain access to funding. And so this past year, 35 communities applied for funding. And all of the communities that participated in our Rural Complete Streets Summit were all funded. And so for communities under 5,000, there's been a over $13 million investment in DOTD funding so that they can improve their sidewalks, create bike paths, and implement other built environment projects. So it's been great.
Your program is having a really deep and rich impact in all of the parishes you touch, and definitely in the rural areas and from an equity perspective. And you're really utilizing and leveraging partnerships to go the way of that. And an example of that is Randy here. Randy, you have a wonderful community center, and I'd love it if you would share a little bit about how your community center recognized the need to expand its programming to support nutrition and physical activity for your neighbors.
Well, thank you very much. Again, my name is Randy Williams, and I didn't really think I'd be coming back to D.C. because I used to be stationed here in the military. I hated the traffic, but
don't we all?
But after 25 years of serving in the Navy, I wanted to come back home and provide a service for my community. And one of the ways that we thought about, or I thought about doing that, is my partner and I, we purchased an old elementary school. In fact, we went to this elementary school as kids. And I remember us having to go out, go to the school after hours, go play baseball, basketball, football, and all kinds of things. But now we don't even see kids out anymore. And that's sad. So when I coached Biddy basketball in the youth program, it was like the kids running up and down the court, and it was really a half court, and they was kind of gasped for breath and like tired, and I'm like, what's going on with this? So at the end of the game, I asked the kids, what do you guys do at home? What do you guys eat? And then, of course, I get the whole thing, McDonald's, Burger King. I said, well, what about fruits and vegetables? What's that, basically, And so with that, I'm thinking, well, what can we do to try to help these kids get more energy and more strength? So we formed a community garden. And in this community garden, we wanted, number one, to get the kids outside get them involved in some fresh air, some sunshine, and to show them how their food is grown and how it gets to their plate, and also to have them try new things. So I can remember a taste test that we did, and I had an eggplant. And I said, how many of you guys want an eggplant? I want to eat eggplant. And of course, no one said anything. I said, well, how many of you guys want pizza? The whole hand, everybody went up in the air. So I went into the kitchen and I prepared the eggplant, but I made it into an eggplant pizza. So when I came back out with the tray, the kids like, what is this? You know, they were thinking of Johnny's or, different kinds of pizza. So once they tried it, they were a little apprehensive at first, but once they saw one trying it, then the next tried, then all of a sudden, everybody started eating, and it's like, it was good. And Mr. Williams, can we get some more? I said, yeah, okay, see, that's what I'm talking about. That's why you guys need to understand that all vegetables are not bad tasting. and we also took this opportunity to kind of do a parent-type nutritional idea of how to prepare new recipes with vegetables. And thanks to LSU Ag, they have really, really stepped up to the plate for us and been a provider for us, because with them, we get nutritional workshop for the parents as well as the kids. And we also let them prepare different types of meals. And just to see them, their facial expression and how they get into it and how they try these different vegetables and stuff. And that's really a big part of us trying to get our kids to eat more healthier. And another thing that we did was we noticed that they didn't get the activity they need. So what we did, we installed an outdoor basketball court. Now, with this outdoor basketball court, I went to my state, I went to my city, I went to the parish for funding. Of course, nobody had funding for recreation equipment, according to my senator, state senator now. I just reached out to the community. In less than 30 days, we raised over $17,000 for my basketball court. So that's how we got kids actually involved, engaged in basketball and playing and trying to be more healthier.
Love this, love this. And you said you started with asking the kids what's going on, right? So you took the pulse of trying to understand from their perspective what were the barriers they were facing to kind of getting health. And so I want to kind of go back on a feedback loop around that. So you've started with what are the challenges they're facing and implementing some solutions around that to this complex problem we're talking about around physical nutrition, physical activity and nutrition. So you started with asking them the question. Now I want to know, what are they telling you about the improvements that they're seeing now in your community? What are you hearing from them about? What feedback are you getting about what you're doing and how it's working? But also, what's next?
Well, I can tell you this. I'll start out with this. With LSU Ag, they formed a coalition meeting. And they're holding it at our community center. And what we do is we invite the families and other community members in so they can tell us what we can do to help them. And so one of the things they had said is that they like to see a walking trail. They like to be able to get out and feel safe, because I don't know, most of you guys probably haven't heard about all the shooting in Louisiana, my little hometown. And a lot of parents don't feel safe or don't want their kids to be outside because of drive-by shootings or whatever. But we wanted the parents to have a say in what we do. We want them to be able to be involved and be engaged, because we want them to come outside. We want them to have a place where they can feel safe. So we wanted to do a walking trail. We want to do a walking trail around our community garden. And by going around the community garden, you're going to have like little postage or signage that's going to talk about a fruit or vegetable that tell them what benefit it has on the body. And we're going to have an exercise sign to tell you, if you do this type of exercise, this is how it's going to affect the body. So that is one of the main things that we're trying to do, and that they're asking us to do, is to provide them somewhere safe that they can go and that they can have fun.
And we just heard you're an incredible fundraiser. That's what I just heard from what you've done. So how are you intending to implement this walking path?
Again, we're definitely going to rely on LSU Ag to really help us spearhead this and try to get us some funding to do this. Also, the community, I do know, they know that if I ask them for something, it's because I really do need it. Because normally my partner and I, we spend money. We bought the school. We renovated the school. We got no federal money or state money to do any type of renovation. We don't pay a salary. We don't have a salary. And you know that if you got people that's just volunteering, they're not going to be as reliable if you have someone that you pay. So I think that with the help of LSU Ag and my charms, I guess, for the community, but I think that they know what I do is I've been doing this since 2016 when I retired from the military, so they know that I'm not a fly-by-night guy, that I am really concerned about our community, and it's not about money because we're not getting any kind of salary, which I do need to replenish the money that I've been spending now. But we definitely will rely on our community and other agencies, and particularly LSU. They are, I may talk so much about how LSU has been to us, and if it hadn't been for them, we wouldn't have our food pantry. We wouldn't have no freezer or refrigerator to expand what we provide to our community. We wouldn't have those nutritional workshops that we sponsor every month. We have them come in and talk about different nutritional stuff. I have senior citizens coming out, and I got them playing senior bingo every Thursday. But before they play, we have to do a particular exercise. Well, of course, you don't have to get out of the chair, but they raise their hand and stretch and do all sorts of things like that. And one of the feedback I get from them is that they are so happy that I'm doing this for them because it gives them something to do, get them out of the house, to get them into our community garden. I'm going to back up to that a little bit, to our community garden where we have Adopt a Row program where you can go out there and you can grow your vegetables, you can keep it for yourself, or you can donate it to our food pantry, or you can come and sell it into our farmers market that we're partnering up with LSU Ag to do a second Saturday farmers market along with our food pantry day. So that way we can ensure that our seniors have access to fresh vegetables and fruit when they come around and pick up their food boxes.
I love it. I love it. Dr. Essel, okay, Kofi. I'm going to turn to you now. So we've heard Jamila and Randy talk about the complexity of the challenges that we're facing in community around physical activity and nutrition and the structural barriers that exist from economics to transportation and how they're addressing it. We tend to call these things, these structural barriers, social determinants of health. And we actually talk a lot about this in our State of Obesity report. But I want to hear from you, how do your patients describe these difficulties when they are talking about health-related social needs? And how much does that impact your ability to really help a patient at an individual level manage their weight?
Great question. In my role now, I'm at Elevance Health, Food as Medicine Program Director. We serve more than 47 million members around the country, providing authentic food solutions to address things like food insecurity, nutrition insecurity, diet-related chronic disease. As a community pediatrician, this is a question that's near and dear to my heart. When I think about what I'm seeing in the clinical space, there are a lot of health-related social needs, social determinants that come up all the time. But the one that we see very consistently is this concept or this topic of food insecurity. And we can start off with that. And why food insecurity tends to crop up first is a variety of reasons. When you think about the food budget, right? When an individual has a sudden financial hardship, that food budget is the first thing to budge, right? Because that food budget is so flexible, it's so fungible. So you oftentimes see a lot of our families experiencing high rates of food insecurity as the first thing, but it often goes along with a lot of other social determinants as well. It typically does not travel by itself. And we know that when families experience food insecurity, a lot of things go along with that. In DC, one of our great food banks in the region called the Capital Area Food Bank did a wonderful analysis looking at food insecurity in the region. Saw 1 in 3 households experiencing food insecurity, right? Very, very high number. It was a large sample size. It told us a lot about what's going on and allowed us to strategically sort of address these challenges a little bit more effectively. National numbers say about 1 in 10 households experience food insecurity. So we know that the rates are quite high. The thing about food insecurity that we have to understand is oftentimes invisible as well. Like it's ubiquitous, it's everywhere, and it's invisible in terms of how it affects our families. When we think about families that experience food insecurity, a few things typically happen. Families typically talk about a lot of anxiety around getting that next meal, right? This constant perseveration, where is that next meal going to come from? The next coping mechanism that typically happens is the quality of food begins to decrease. So my esteemed colleagues was talking about sort of the vegetable desire. Why aren't you eating more vegetables? A lot of families will say in the clinic, hey, I'm not eating these vegetables because I don't know if they're going to last. Right? I want to purchase foods that are going to last. I want to purchase foods that my children are going to eat and that we can purchase and feel good about them as well. So sometimes with that increased stress, I would label it a toxic stress, a persistent stressor that happens and affects our families. they oftentimes may gravitate towards foods that are higher in sugar, higher in salt, higher in fat. That vegetable full of that water and fiber doesn't give you that same pack, that punch as some of these other sugar-rich items. Families typically then gravitate towards foods that are higher in sugar, lower in, or higher in caloric density, lower in nutritional value as well. So I think in general, we need to understand that. Now, as a clinician, if I don't keep that in mind, if I don't keep in mind the challenges, the health-related social needs, then I'm risking sort of a misalignment on expectations and goals in ways I engage with my patient, because I'm assuming that, hey, everything is fine, you should eat that kale quinoa bowl that I'm recommending. And the reality is sometimes we need to instead meet our families where they are and walk alongside them on a journey versus trying to get them to this esoteric place that we think that we are. And I think that's why it's important.
Lovely, thank you. So on our last panel, one of the last questions was around stigma. And as a person living with obesity, thriving and living with obesity, might I add, I think it's a really important question about how, as a nation, we really work to destigmatize the challenges we have around obesity and really move into partnership. And so as a physician, how do you do that? How do you destigmatize obesity and enter into a partnership with your patients to thoughtfully address the challenge?
Ruth, I think you already answered this question. We can go. But I think honestly, it's a great question. So I think about this topic a lot. I've worked closely with a lot of groups, some in the room today who are doing some phenomenal work in this space. When I think about physicians in particular, one of the things that I think is the most important thing to start off with is an awareness of one's own bias that one carries, right? The assumption is that bias always exists with somebody else, never with ourselves, right? When this bias is brought up, it's like, oh, well, I don't have bias towards individuals with obesity. I treat everybody nicely and equally and all these things. But the reality is this is one of the first places to start. Helping physicians, clinicians realize their own bias and what they're bringing to the table. And realize that when they have bias towards their patients, that the way they engage their patients is going to be affected. Their patients, the way they look at themselves is going to be affected. The optimal care that you're trying to provide is going to be limited because of how you see your patient. So it's important that we sort of have an awareness of the dignity that is needed in engaging patients and providing that humanity back to individuals, right? And some people talk about using this terminology of person-first language, right? So some people like it, some people don't. But the whole notion of person-first language is this is a person with obesity, recognizing this person as a person first. And I think that's a critical piece to this challenge. Now, the other thing I would say is that we have to sort of move along in this journey and understanding obesity as what it really is. We typically, in the clinical settings, outside of clinical settings, people look at it as a moral failing, as an issue of you just need to eat better and yet exercise more. But when we do that, we don't understand the complexity of obesity. So part of the training needs to be to understand the complexity of obesity. Obesity, a complex, chronic, multi-system disease that requires a multidisciplinary approach. When we do that, we can start to talk about these other risk factors, not just diet and exercise, but sleep and stress. We can talk about anorexigenic and orexigenic pathways. We can talk about the medicines that I'm actually giving you that is actually worsening weight gain. We can talk about metabolic adaptation. There's so many other things to talk about. So when we do that, we open up the ballgame of what we can think about, how we can engage this topic more effectively. And I think that's a critical piece. And the last thing I would say is that we need to change our posture and engage our current providers to change their posture. We need to be thinking more heavily about health versus cosmetic standards of Western beauty and fitness, right? And I would argue, physicians are thinking about health all the time, of course, aren't we? We're human beings. We're bombarded by the same media and other reasons why we all carry stigma as well. So it just happens to be the fact that we then stigmatize our patients because of this clouded lens that we have towards our patients. So leaning towards that health parameter allows us to do a few things. When we think about health, we can focus on more than just a number on the scale, right? Because when that number on the scale doesn't change, why should that patient come back to see me again? Why should I care about engaging this patient? Because you're not listening to me because the number hasn't changed, clearly. But when we start to look at this more than just a number on the scale, we can talk about other things. Our strength, our mental health, our flexibility, our laboratory changes, our sleep, our stress, our joint pain. Like there's so many other things we can be talking about that's focused on health than just weight itself. And I should also say, sometimes weight itself is a concern for patients. They bring it up. Weight itself is something that we need to talk about, right? It may be pushing on organs. It may be worsening sleep apnea. It may be causing worsening joint pain. And in those times as well, we can think about other tools. We can talk about diet and exercise, sleep, stress. We can also talk about things like medications. We can talk about things like procedures as needed as well. There's a variety of tools that we can use, but we have to recognize meeting our patients where they are, person-centeredness, teaching through that lens, and recognizing the complexity of obesity at the same time.
Now, I could talk to the three of you all day long in my own living room by myself, but I've got to invite the people inside. So it's now time for us to turn to you. If there are any questions that you all have in the audience or from our live stream, we would love to have an opportunity to have Jamila, Randy, or Kofi answer your questions. I think I see Madison with an online question.
Hello. I believe this question would be best for Dr. Essel. So a question from online is, what role have you seen health plans, Medicare, and Medicaid play in addressing healthy food access?
Great question. I can speak about our work at Elevance Health. Elevance Health is, we used to be known as Anthem, right? And we are really leaning into this concept of food as medicine in particular. Now, with this concept of food as medicine, the way we define food as medicine these are strategies or interventions that are working alongside healthcare, that are giving access to high quality foods that either prevent, manage, or treat disease, right? So we look at that as a tool. Now, when we think about that, we also take into account local food systems, how we're working with local community-based partners and these things as well. But some of the work we're doing right now, we are currently, our foundation in particular has committed $30 million towards authentic food as medicine solutions around the country. We're creating digital apps to work with our members around the country to help them with their decision-making tools, being able to access the right resources around them. This concept of food insecurity, we don't close our eyes to as well. So we are working on the ground with connecting our members to local community resources, but of course, as our previous colleague or panel talked about earlier, federal nutrition programs that are meaningful, that are effective, that are evidence-based, time and time again have been shown to improve overall health for our patients and families. So we're leaning into all of these programs, and we're doing that actively right now, running some pilots with every line of business. Something that we are really, really excited about is thinking about how we can incorporate food as medicine into our commercial line of business, our Medicaid, and even our Medicare lines of business as well. So we're doing a lot of great work in that space.
Thank you. Yes, I see a question over here. We're going to wait for just a second to get the mic to you.
Hi, my name is Eduardo Sanchez. I work for the American Heart Association. I'm on the board of Trust for America's Health. Thanks to each of you for what you do and for sharing what you're doing. And I want to ask this question in the spirit of sharing. What Elevance is doing is amazing. And many of us, what I would ask is Elevance going to be doing this in a way that will help all of us benefit from the evidence that y'all will be producing that then others can put to work? This is great work. And other full disclosure, I served as Chief Medical Officer for Blue Cross Blue Shield of Texas. So I say this, sometimes we shared stuff, sometimes we didn't share stuff. And so I ask this in the spirit of the willingness to share stuff so that the rest of us can benefit from the things that work and not do the things that didn't work.
That's a great point and comment, and it looks like it's your family, Elevance Health family too. So for sure, I think that is something we want to figure out how to do better, communicate what we're learning from our families, from our members, externally as well. Because ultimately, what our goal is, our purpose is to improve the health of humanity. That's what we lean into. That's what we're trying to do in the work that we're doing. That's why we're thinking outside the box and trying to do this in very innovative ways. So this is what we want to do, and I look forward to talking more about that.
Thank you. Any other questions? I see another one coming.
This would be great for Jamila and Randy. What is one thing a food policy council or coalition can do at the local level to support food security and access?
That's a really good question. In Louisiana, that is something that we are definitely working towards doing, particularly in the Northeast region where Randy is. And we're really wanting these food policy councils to drive policy in these areas, and that could be impacting the supply chain to work with our legislators and the like to get fresher foods and vegetables into our grocery stores. A few years ago, we did some focus groups. A lot of the members on our team are qualitative researchers, so we do a lot of focus groups and we talk to a lot of people about what's going on. And so that is one thing that they talked about, was the fact that in our grocery stores we want to buy fresh fruits and vegetables, but a lot of them are not. A lot of the things in the grocery stores are not quality. So I think that's something they can address. I think transportation is another thing that they can address as well, because access, that I think that's a buzzword that we all know about, is an issue, and transportation to get to the doctor, to get to the grocery store, to get to the food pantry, to get to the farmer's market is something that needs to be addressed. So figuring out what assets in their community already exist that they can leverage. I was having this conversation, I think last week at a health equity conference about, has anyone ever thought about reaching out to the local churches and figuring out how can we leverage church buses and using our resources to pay the drivers, to train the drivers and things like that, to really create some kind of transportation system within a small community that may need it. So I think, off the top of my head, those are a few things. I don't know if Randy may have some
Well,
other
I can tell you this, is what we've done is that we partnered up with the local farmers, and we get fresh vegetables directly from the farmers. We've also got a egg producing farmer that every day that I come into the office and I see a carton of eggs sitting on the doorstep saying, hey, I just bought you some eggs this morning. So we give those out to our food pantry personnel, but mainly it's just being involved with local farmers where they provide different types of fruits and vegetables that they grow.
Yeah. And to follow up on that, a lot of our small farmers are older adults. And so when we are talking to them about accepting SNAP benefits, we have to walk them through that process because the process has changed with technology. And so a lot of them, that can be a barrier for a lot of our small farmers and on their business. Because a lot of them want to. I think accepting SNAP and other fruit and vegetable voucher programs are a huge benefit to their business, but applying for it can be difficult for some, is what we've seen. So I think working to provide more technical assistance and also support our small farmers, because farmers are not getting younger. So I think that's another point.
Well, I'd like to thank each of you so much for sharing your experiences and your reflections about what you're doing to promote health. I see a lot of opportunities across the three of you, but also for our listeners and those who are on the live stream. Let's give a round of applause and thank you for their time. And as we transition from the stage, I'd love to welcome Nadine back, who will introduce our final speaker for this event.
Thank you, Takesha, and really a terrific panel. It's also really great when you hear connections being made throughout an afternoon. And I've been excited about this entire day, but some people on our team know I was really excited about what I'm about to do right now because of the power of sports. And Mr. Randy actually talked about and gave the example that kids were playing basketball, and you're seeing that they were not able to run up and down the court, and the power of sport to actually tap you into now access to healthy nutrition and physical activity. So I am excited and ask you all to turn your attention to the screen. We have the great pleasure, I hope she will be coming up shortly, I'm gonna speak slowly here, to welcome an amazing person that is going to provide us with a motivational message for our closing remarks. But I am really honored and pleased to introduce Shantae Lowe. She is a 4-time Olympian in the sport of track and field. She is an Olympic bronze medalist, an American record holder in the high jump, and she is a member of the President's Council on Sports, Fitness, and Nutrition. We are so thrilled to have you joining us, Shantae. I will turn it over to you.
Hi, everyone. I'm so excited to be here. Thank you for allowing me to be the closing remarks speaker for today. As discussed earlier today, regular physical activity and healthy eating are two critical components for a healthy lifestyle. Now, unfortunately, as we've heard, many individuals may not have access to safe places to be physically active or have the financial ability to purchase healthy foods. I remember watching the Olympics when I was 4 years old, and I see this woman on my screen by the name of Flojo. She has this long, beautiful hair, these gorgeous nails, and the muscles in her legs allow me to see for the first time that strength is gorgeous. Armed with that inspiration, I immediately went out and tried out for my local soccer team, only to be met with disappointment. The coach realized that I didn't really belong there. He told me that I could not afford the fee, kicked me off the field. I left embarrassed and ashamed, but luckily for me, the track coach stepped in. He said, "You don't need anything more than your shoes, a good attitude in yourself." I ended up joining the track team, and the rest is history. I got to compete all over the world, representing Team USA, as an Olympian 4 times. I've won 12 US national championships. I've ended up getting to compete on 3 different continents. But one of the things that was fundamental and foundational throughout that process is that when I was growing up, I grew up in an impoverished household. I was a member of the free lunch program. So I was able to eat at school, but when I was at home, meals were few and far between. When I started playing sports, I started noticing that my energy was extremely low, and it even threatened me to the point where I would have to stop competing. But we had a community center that would provide fresh free meals after school. And so I was able to go get a free meal and then go to track practice. And that's why I'm able to be here today. I am so proud to have been asked to serve as a member of the President's Council on Sports, Fitness, and Nutrition, where we're working to spotlight the challenges that many individuals face. Families, communities, many individuals face, as well as families and communities, as we're striving to have a healthy lifestyle. Now, members of the President's Council provide advice to the federal government regarding opportunities to extend and improve physical activity, fitness, sports, and nutrition programs, as well as services at the state, local, and national level. Now, priorities of this council are to promote the National Youth Sports Strategy to expand the children's participation in sports. My husband is a PE teacher, and he has noticed the same thing that you guys are talking about today. The children are not able to run around the track or around the field. They are desperately in need of finding programs and ways for them to be more physically active. So we also are focused on expanding the national awareness and importance of mental health as it pertains to physical fitness and nutrition. And finally, we're supporting the implementation of the national strategy on hunger, nutrition, and health, and fostering partnership to advance the dissemination of these key messages that we've discussed here today from these strategies. Now, we're hoping to affect change and achieve the goals of this council, but in order to do so, we rely on clear and actionable health information from the federal government. The Office of Disease and Prevention and Health Promotion focuses on the translation of current science in nutrition and physical activity through dietary guidelines and physical activity guidelines for Americans into actionable, trusted guidance that can be disseminated by a wide range of partners, including the President's Council in Sports, Fitness, and Nutrition. Now, the physical fitness activity guidelines provide evidence-based recommendations for the amount and types of physical activities people need to promote health and reduce the risk of chronic disease. Many of you guys don't know, but I am a breast cancer survivor. And I know that these foundational steps that start with our youth are so vitally important in order to achieve health equity as well as access to all Americans and not just the select few. The Move Your Way campaign is the communication campaign for the physical activity guidelines and has over 80 science-based resources available in English and Spanish to help Americans take steps towards a more active life. These resources include materials like fact sheets and posters, as well as videos. So what I've learned is that sports provide an important way for individuals to get the recommended amount of physical activity. But as you learned from little parts of my story, not all youth have the same opportunity to participate in sports, which results in varying participation rates across various demographic groups. Like, for example, we have noticed that girls, racial and ethnic minorities, and youth from households of low socioeconomic status, as well as youth living in rural areas and youth with disabilities, have lower rates of participation compared to their peers. We think about that group, that is a large number of children that are not participating. So the Youth National Sports Strategy is a federal roadmap designed to unify US youth sports culture around the shared vision that one day all youth will have the opportunity and the motivation to access sports and play. When it comes to the dietary guidelines for Americans, it provides the science-based advice on what to eat, what to drink, and promoting health that reduce the risk of chronic disease. It helps us meet the nutrient needs, and these dietary guidelines designed for policymakers and nutrition and health professionals are to help individuals and their families consume a healthy, nutritionally adequate diet. The guidelines provide the basis for federal nutrition education materials designed for the public and for the nutritional educational component of the HHS and the USDA nutritional programs. So given the complexity of the many health challenges that we're facing today, we always must be in collaboration and consultation with one another. Through these partnerships with the public, the private, the nonprofit sector, the council promotes these programs and initiatives that motivate people of all ages, backgrounds, ability to lead active, healthy lives. I'm so honored that I was able to be here and be able to share with you, listen to everything that we're doing. And I want to say that if I did not have someone like you stepping in and have this foundation be so prevalent in my own life, I don't know where I would be today. So exactly 4 years ago, I rang the bell. And I know it's Breast Cancer Awareness Month. I rang the bell. I ended my battle with breast cancer victoriously, but I know that foundation came through sports and access. So thank you for all that you do. Thank you for listening, and thank you for being here.
Effective policies and programs that truly can help us to create these healthier environments and improve the health and well-being of our nation, and our focus being total health and well-being. But it's going to take leadership, commitment, increased and sustained investment and resources. That is critical. It's going to take all of us working across sectors at all levels of government and with authentic partnership and the voice and leadership of communities to improve the health of the entire nation. The community solutions are there. We have to invest and sustain that investment. So our commitment and joint efforts truly can advance a movement for meaningful and lasting change. And certainly we at Trust for America's Health look forward to continuing to be a partner in that movement and in that journey. So I'd like to thank everyone. I hope that you learned new things, tested out new ideas in your minds that you can take back to the work that you do, but I hope that we do that work together, because we really, truly need to come together in order to address the inequities that we see in health in our nation and to be able to improve health for every person and community. A recording of today's event is going to be available on our website at TFAH.org in the coming days. And our State of Obesity, the 2023 State of Obesity Report, is currently available on our website. And again, for those of you that are here in person, if you haven't picked one up, we do have printed copies of the report that are available at the registration desk. So let me conclude with some thank yous. Please join me again in thanking all of our speakers for today who provided such inspirational comments. I'd also like to thank all of our partners and all of the individuals and organizations who are here in the room and those who are joining us online, our event management team of PSA, AI Media Captioning Service, who provided the live captioning service, Purple Communications, who is providing the on-site sign language interpretation. And you heard some questions from them. I would like to acknowledge and ask the members of our Board of Directors who are here today. We have some of our TFA Board of Directors. Please do stand so that the audience can see our board members. Or wave, yes, in the back over there. Thank you. And most importantly, I would like to ask them to also stand, the TFAH staff and interns, our fabulous, amazing TFAH team, who has been hard at work planning and carrying out this event. Thank you, thank you, thank you. So for our virtual audience members, this concludes today's event. For our in-person audience members, we invite you to join us for a reception that is just outside of this room. Mix and mingle, network, and let's create more strategies and solutions to advance the health of our nation. Thank you, everyone.